Hello, my name is Siddharth and my topic is ultrasound guided subgluteal sciatic nerve block. As we all know that lower 2 nerve root L4 and L5 and upper 3 sacral root S1, S2, S3 they all form sacral plexus. 7 nerves stem from the sacral plexus, 6 collateral branches, and 1 terminal branch that is sciatic nerve. The sciatic nerve is the largest peripheral nerve in the body and measures more than 1 centimeter in width at its origin. It exits the pelvis through the greater sciatic notch below the piriformis muscle, then descends between the greater trochanter of the femur and the ischial tuberosity. The nerve then runs along the posterior thigh to the lower third of the femur, where it diverges into 2 large branches, the tibial and common peroneal nerves. This division may occur at any level proximal to the lower third of the femur. The common peroneal and tibial nerves are separated from their onset at the sacral plexus in 15% cases. From its onset, the sciatic nerve also gives off numerous articular, hip, knee, and muscular branches. In the upper part of its course, the sciatic nerve lies deep in the gluteus maximus muscle and rests on the posterior surface of the ischium. The sciatic nerve crosses the external rotators, obturator internus, and gemelli muscles, then passes on to the quadratus femoris. The quadratus femoris separates the sciatic nerve from the obturator externus and the hip joint. Medially, the posterior cutaneous nerve of the thigh and the inferior gluteal plexus accompany the sciatic nerve, whereas more distally the sciatic nerve lies on the adductor magnus. The long head of the biceps femoris crosses the sciatic nerve obliquely. The articular branches of the sciatic nerve arise from the upper part of the nerve and supply the hip joint by perforating the posterior part of its capsule. However, the articular branches are sometimes derived directly from the sacral plexus. The muscular branches of the sciatic nerve innervate the gluteus, the biceps femoris, the ischial head of the adductor magnus, the semitendinosus, and the semimembranosus muscles. The branches for the ischial head of the adductor magnus and semimembranosus muscles arise from a common trunk. The nerve to the short head of the biceps femoris comes from the common peroneal division, whereas the other muscular branches arise from the tibial division of the sciatic nerve. With the transgluteal approach, the sciatic nerve is approached deep to the gluteus maximus muscle, where it is identified between 2 osseous landmarks, the ischial tuberosity and the greater trochanter. To obtain view of the sciatic nerve and the osseous structures at this level, with the subgluteal approach, the nerve is just below the level of the gluteal crease where the nerve lies more superficial, and can be imaged even with a linear probe. These are the sensory supply of sciatic nerve and its branches. This block is used to provide analgesia and anesthesia for any surgery of posterior thigh, knee capsule and upper tibia fibula. Scanning is usually performed in lateral position just like in picture. Usual machine setting is curvilinear probe with general mode using depth 4, 8 cm keeping in plane approach using 15, 20 ml of local anesthetic. The important landmark structures for this block are greater trochanter and ischial tuberosity. Curvilinear probe is put in between greater trochanter and ischial tuberosity just like in picture. At the transgluteal level, the sciatic nerve is visualized in the short axis between the 2 hyperachoic bony prominences of the ischial tuberosity and the greater trochanter of the femur. The gluteus maximus muscle is seen as the most superficial muscular layer bridging the 2 osseous structures, typically several centimeters thick. The sciatic nerve is located immediately deep to the gluteus maximus muscle and superficial to the quadratus femoris muscle. Often, it is slightly closer to the ischial tuberosity than to the greater trochanter. At this location in the thigh, it is seen as an oval or roughly triangular hyperachoic structure. At the subgluteal level, the sciatic nerve is positioned between the long head of the biceps femoris muscle and the posterior surface of the adductor magnus. After screening, one can rotate probe to lie parallel to course of sciatic nerve to visualized sciatic nerve on long axis. Let's see the screening video. Let's see real block video. Let's check out some clinical pearls. First, I usually prefer curvilinear probe oval ear probe as one can visualize a wider field including osseous landmarks. Second, never inject against high resistance, 15C. Thank you very much for your kind attention.